Are you suffering from low back pain with hip groin pain as well as difficulty standing up after prolonged sitting? Welcome back to my channel, Annie Pilates Physical Therapist. I'll be demonstrating simple exercises to target the Psoas Syndrome, which is a tightness of the psoas muscle with a bolster or a rolled towel. So get your mat ready and join me. So let's discuss a little bit anatomy of the psoas muscle with a silent P. So psoas is a muscle that originates on your lumbar from T12 thoracic actually all the way to your lumbar spine. So it's the transverse process as well as the intervertebral disc. So just imagine if you have back injury from sports, and it's also common for those who jump rope and high impact activities. So it's always misunderstood just a back pain, but it's also the psoas muscle gets tight and spasm, so it causes this rounded posture. So it gets tight and pulls your hip area all the way to hip groin. So it's always misunderstood as a low back pain only or a hip pain. And without targeting the problem, then it's always there. So it's a muscle that helps flexion, but once past 90 degrees, it's also activated more. So past 90, as well as a little bit external rotation of your hip. So this muscle combines with the iliacus. Iliac starts on the iliacus, iliac crest of your pelvic bone, and it bundles together. The three of them, psoas major, psoas minor together, and then the iliacus. So three of them all the way to your lesser trochanter of your femur bone. So it's all the way to your thigh. And because it's a deep muscle, it's hard to palpate to find them. So I'll show you some myofascial release on how to release the tension. So the first exercise is a gentle stretch with a roll towel or a bolster. Or if this is too aggressive for you, you can go at the edge of the bed and just dangle your leg to bending and external rotate to open that muscle. But for those who wants to do a little bit more, place it on your lumbar area, bend the other leg to support your back and stabilize your pelvic, and inhale, exhale, extend the other leg where you have problem if it's your left. So inhale, exhale, and you feel this lovely stretch on the origin of the muscle, which is your lumbar, as I said earlier, and the bolster is like a massage. And then for the myofascial release, because it's really deep, use your thumb and press. And my recommendation for beginners to hold that for 10 seconds hold with your breath and then blow. Exhale, and you feel that relaxation going on. So inhale, exhale. If you're having spasm, and slowly let go more, and then you feel lengthening more of this deep psoas muscle. So I'm pressing it down near your iliac crest here. See this bone on the iliac? So it's between the iliac, it's beneath the abdominal muscle, and you really press it down. Inhale, exhale. Last breath, inhale, exhale. My recommendation is 10 seconds hold, slide it back up to 10 times for beginners. And if that's too aggressive, you can always start 2 to 3 seconds, and then you can progress to 30 seconds. And after doing that, it's best to strengthen the muscle. So how do we strengthen it? It activates more when it's past 90 degrees. So when you go 90 with your knee straight, if you have tight hamstrings, you can always have it bent as long as you pass 90, and then you make circles. Inhale, exhale. With your knee bent, you're activating your quads a little bit more, but with the knee straight, you really target more of your psoas muscles, and then toes pointing you to stretch more. So 10 times clockwise, and then 10 times counterclockwise with your breathing and engaging your core muscles to support your spine, and blow. And the progression in this is bigger circles. So you go down, inhale, and exhale down. So you're going more range of motion. And my recommendation is 10 times clockwise So I'm going down and out, and then 10 times reverse. So out and then up. Inhale, exhale. And do that as well 10 times. I know it's a little bit aggressive, but it's okay. It will get stronger. So after doing that, most patients also have glutes weakness. It's best to do some bridging to co-contraction on your psoas. It's the opposite muscles of your glutes. It's the psoas. So when you do bridge, it helps concentric here in your, and then slowly lengthening. Slowly go down one vertebrae at a time as you slowly bone to bone to help release the psoas at the back. And blow. I know bridging targets the glutes, but you'll be surprised it helps your psoas as well. So as a hip flexor, you're lengthening it. So inhale and then exhale one vertebrae at a time and blow. And my recommendation is 10 times. And when you go up, I want you to hold this for 10 seconds. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Pull your belly button in and then go down one vertebrae at a time and blow. And after doing that, then you can do side lying position to stretch your quads as well as your psoas. So when you bend your knee, it targets the quads, and then when you pull back more to external rotate, it really targets your psoas more. And you feel it on your back to release the spasm. So keep the other leg straight, stabilize your pelvis, and inhale and hold it for 10 seconds. Hold and then back and blow. Last one. Then take a deep breath. Inhale, exhale, and hold it for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And do that 10 times as well. And after doing that, then you can do the lunge. One leg forward. I'm targeting my left. My left knee is down the mat. My right knee is forward. And slowly lean forward until you feel that lovely stretch. And take a deep breath and hold it for 10 seconds. Hold again. 10, 9, 8, 7. And keep your back straight and look up. 2, 1, and back. 10 seconds. Hold. 10 times again. And the last one is pigeon stretch. So this is the next progression. If this is too hard for you, you don't have to do pigeon stretch yet. You can always do it as you progress more and feel your spine as you feel the release. 90 degrees in the front, lengthen, keep the knee straight, and look up to target your psoas. Inhale and exhale down to stretch your glutes on your right. Alternating 10 seconds, hold up, inhale, exhale. Alternating 10 seconds, hold, and 10 times. And if you want to balance everything, you can do it both sides as well. If you love this video and want to learn more about Pilates, yoga, physical therapy, health, and wellness, please subscribe to my channel and ring the notification bell so you won't miss anything. You can message me on my social media or leave a comment down below, and please support my channel by checking out my Patreon account. Thanks again for joining me. I'm hoping you're feeling better on your psoas muscle, and keep doing it. Always remember, be safe, be well, and healthier you. Until next time, bye!